Hello! In this video, we are going to talk about mental retardation and learning disabilities. Now, let's start with the definition of mental retardation. The American Association on Mental Retardation had spent more than 5 decades of study on what mental retardation is. Mental retardation refers to substantial limitations in present functioning. It is characterized by significantly sub average intellectual functioning existing concurrently with related limitations in two or more of the following adaptive skills area: communication, self care, home living, social skills, community use, self direction, health and safety, functional academics, leisure, and work. Now, mental retardation manifests before age 18. Now, let's talk the classification of mental retardation. The criteria in American Association on Mental Retardation definition are very extensive. Thus, a system of subcategories or levels of mental retardation was developed. Traditionally, subcategories have been based on IQ ranges. In the previous classification system, there are four levels that are still widely used today. Number one, mild mental retardation with IQ scores from 55 to 70. Number two, moderate mental retardation with IQ scores from 40 to 54. Number three, severe mental retardation with IQ scores from 25 to 39. And number four, profound mental retardation with IQ scores below 25. The American Association on Mental Retardation has introduced a new system of classification that is based on the amount of support that a person needs in order to function to the highest possible level. The four categories of mental retardation, according to the intensity of needed supports, are: number one, intermittent supports, means as needed basis. That is, the person needs help only at certain periods of time and not all the time. Number two, limited supports, means it is required consistently, though not on a daily basis. The support needed is of non intensive nature. Number three, extensive supports are needed on a regular basis. Daily supports are required in some environments, for example, daily home living tasks. And number four, pervasive supports are daily extensive supports, perhaps of a life sustaining nature required in multiple environments. Now, what causes of mental retardation? There are more than 250 identified causes of mental retardation. The American Association on Mental Retardation classifies the causes based on time of onset, categorized as prenatal or biological, perinatal, and postnatal, and environment. Now let's talk with the biological causes. Known for about two-thirds of individuals with the more severe forms that include the moderate, severe, and profound. Let's talk environmental causes. Are traced to a psychological disadvantage which is a combination of a poor social and cultural environments early in the child's life. Now, let's talk about the prenatal causes of mental retardation. One is the Down syndrome. It is named after Dr. Langdon Down, is the best known and well researched biological condition associated with mental retardation, caused by chromosomal abnormality. The most common is trisomy 21, in which the 21st set of chromosomes is a triplet rather than a pair. Trisomy 21 most often results in moderate level of mental retardation. The characteristic physical features are short stature, either flat, broad face with small ears and nose, upward slanting eyes, small mouth with short roof, protruding tongue that may cause articulation problems, hypertonia, or floppy muscles. Heart defects are common. Susceptibility to ear and respiratory infections. Older persons are at high risk for Alzheimer's disease. Next is Klinefelter syndrome. Males receive an extra X chromosome. Sterility, underdevelopment of male sex organs, acquisition of female secondary sex characteristics are common. Males with XXY sex chromosomes instead of their normal XY often have problems with social skills, auditory perception, language, sometimes mild levels of cognitive retardation. This condition is more often associated with learning disabilities than with mental retardation. Next is Fragile X syndrome, a triplet or repeat mutation on the X chromosome interferes with the production of FMR1 protein, which is essential for normal brain functioning. Majority of males experience a mild to moderate mental retardation in childhood and moderate to severe deficits in adulthood. Females may carry and transmit the mutation to their children but tend to have fewer disabilities than effective males. The condition affects approximately 1 in 4,000 males. It is the most common clinical type of mental retardation after Down syndrome. It is characterized by social anxiety, avoiding eye contact, tactile defensiveness, turning the body away during face to face interactions, and stylized, ritualistic forms of greeting. Preservative speech often includes repetition of words and phrases. Next is Williams syndrome. It is caused by the deletion of a portion of the seventh chromosome. Cognitive functioning ranges from normal to mild and moderate levels of mental retardation. The characteristics are elfin or giraffe like facial features, the physical features and manner of expression exude cheerfulness and happiness, overly friendly, lack of reserve towards strangers, often have uneven profiles of skills, with strengths in vocabulary and storytelling skills, and weaknesses in visual spatial skills. Often hyperactive, may have difficulty staying on task, and low tolerance for frustration or teasing. Next is Prader-Willi syndrome. Is a syndrome disorder caused by the deletion of a portion of chromosome 15. Initially, infants have hypertonia or floppy muscles and may be tube feed. The initial phase is followed by the development of appetite. It is associated with mild retardation and learning disabilities. Behavior problems are common, such as impulsivity, aggressiveness, temper tantrums, obsessive compulsive behavior, some forms of injurious behavior, such as skin picking, delayed motor skills, short stature, small hands and feet, and underdeveloped genitalia. Next is phenylketonuria. PKU is one of the inborn errors of metabolism. PKU is a genetically inherited condition in which a child is born without an important enzyme needed to break down an amino acid called phenylalanine found in dairy products and other protein-rich foods. PKU has been virtually eliminated through widespread screening. Now, the environmental influences under biological causes of mental retardation include maternal malnutrition, irradiation during pregnancy, juvenile diabetes, and fetal alcohol syndrome or FAS. FAS is one of the leading causes of mental retardation. The mother's excessive alcohol use during pregnancy has toxic or poisonous effects on the fetus, including physical defects and developmental delays. Now let's talk with the perinatal causes under mental retardation. We have intrauterine disorders such as maternal anemia, premature delivery, abnormal presentation, umbilical cord accidents, and multiple gestation in the case of twins, triplets, quadruplets, and other types of multiple births. Next is neonatal disorders such as intracranial hemorrhage, neonatal seizures, respiratory disorders, meningitis, encephalitis, head trauma at birth. Now, the postnatal causes under mental retardation includes head injuries, infections, demyelinating disorders, degenerative disorders, seizure disorders, malnutrition, environmental deprivation, and hypoconnection syndrome. Let's proceed to the educational approaches on mental retardation. Students with mental retardation needed a functional curriculum that will train them on the life skills, which are essentially the adaptive behavior skills. Number one, the Montessori method. On the other hand, it aims to develop the child's sense of self mastery, mastery of the environment, and independence by focusing on his or her perceptual and conceptual development as well as in the acquisition of skills in self care and daily living activities. Number two, Ypsilanti Perry Preschool Project were derived from Piaget's cognitive development theory. The cognitively oriented curriculum is used in teaching disadvantaged children with mild retardation who are 3 to 4 years old. Number 4, the Portage Project is used to precision teaching model to deliver a home-based curriculum in language, self-help skills, cognition, motor skills, and socialization. Number 4, the Carolinas Absidarian Project includes parent training, social work services, nutritional supplement, medical care, and transportation. Now, Let's talk about methods of instruction in mental retardation. Teaching children with mental retardation requires explicit and systematic instruction. One such method of teaching is the applied behavioral analysis, which is derived from the theory and principles of behavior modification and the effect of the environment on the learning process. Task analysis is the process of breaking down complex or multiple skills into smaller, easier to learn subtasks. However, in active student response, the observable response made to an instructional antecedent is correlated to the student achievement. Systematic feedback through positive reinforcement is employed whenever needed by rewarding the students' correct responses with simple positive comments, gestures, or facial expressions. Students with mental retardation in inclusive education. There are many children with mild and moderate mental retardation that are enrolled in the regular classroom. They are mainstream in the academic subjects of the regular teacher and the special education teacher. Mainstreaming activities for children with the more severe forms of mental retardation are more selective. They participate in social activities, sports, and co curricular activities like Special Olympics, camping, scouting, and interest clubs. Here are some suggestions for the special education teachers and the regular teachers in whose classes students with mental retardation are mainstream. Number one, together, study the student's IEP and agree on the teacher's roles and responsibilities to make inclusive education and mainstreaming work. Number two, set regular meetings with each other, with the students or their families to assess how effective the program is going and what else needs to be done. Number three, encourage acceptance of the student by the classmates by setting an example and giving the student the chance to show that he or she is more like the others than different. Number four, use instructional procedures that will be benefit to the students, such as demonstrating the more complex and difficult task and providing multiple opportunities for practice. Number five, assign a peer tutor to assist the student during independent activities. Number six, in class lectures, utilize the lecture pause technique. Number seven, pair students with mental retardation with non disabled classmates who have similar interests. And lastly, encourage regular students to assist the students with mental retardation as they participate in class activities. We are now done with students with mental retardation. Let's proceed to learning disabilities. Learning disabilities was first introduced in 1963 by Dr. Samuel Kirk, a well known American special education expert. In the Philippines, special education for children with learning disabilities is only in its early years of implementation, unlike the special education programs for children with mental retardation. Children with learning disabilities have relatively average or even above average intelligence who experience severe learning or academic problems in school. Learning disabilities is a generic term that refers to a heterogeneous group of disorders manifested by significant difficulties in the acquisition and use of listening, speaking, reading, writing, reasoning, or mathematical abilities. Now let's talk with the causes of learning disabilities. First is the brain. The brain is contained within the hard bones of the skull and cushioned against injury by surrounding membranes, while the spinal cord The central pathway of nervous system runs through a channel within the top vertebrae of the spine. There are three major areas in the brain: the cerebrum, that is largest part of the brain, associated with conscious activities and intelligence. The cerebellum coordinates movement and balance. Last is the brainstem. It connects the brain to the spinal cord. Aside from the brain, we have the nervous system, a network of nerves extended throughout our bodies, carrying sensory information to the brain and instructions from it. The brain and the spinal cord together from the central nervous system. The rest of the network is known as the peripheral nervous system. Let's talk about teaching students with learning disabilities. Special education experts highly recommended the use of the diagnostic prescriptive evaluation approach in teaching children with learning disabilities as well as those with mental retardation. Here, the results of assessment are used directly to draw up an individualized educational plan. The long term annual goals that the student can achieve are identified. Then the short term quarterly objectives are prescribed. Monthly, weekly, and daily instructional plans are written to achieve the preset goals and objectives of teaching. Formative and summative evaluation procedures are employed to track the mastery of the skills. I hope you all learned something about students with mental retardation and students with learning disabilities. Thank you for watching. Goodbye.